So imagine this. A patient comes into the emergency room. Someone looks at the chest x-ray and immediately says, "Oh, the patient has a collapsed lung." But here's the interesting part. A lot of times, what they actually mean is pneumothorax. And in normal day-to-day conversation, people use these two terms like they mean the exact same thing. But medically, they're actually different things, and understanding that difference can save you from a lot of confusion while reading chest x-rays or studying respiratory medicine. Now, before we even talk about pneumothorax, we need to quickly understand one important term: atelectasis. You've probably heard this word many times in medical school. Atelectasis basically means loss of aeration of the lung because the tiny air spaces inside the lung collapse or cave in. Think of it like a balloon that has completely deflated. The balloon isn't filled with anything. It has just lost its air and shrunk down. And this is where students often mix it up with consolidation. In consolidation, those air spaces are filled with something, maybe pus in pneumonia, fluid in pulmonary edema, blood, or some other material. But in atelectasis, nothing is filling the spaces. The air spaces are simply collapsed. Now, when the entire lung becomes atelectatic, we often casually call that a collapsed lung. Sometimes even a single lobe can collapse, which we call lobar collapse. So technically, when we say collapsed lung, we're really talking about severe or complete atelectasis. But pneumothorax is a completely different concept. Pneumothorax simply means there is air inside the pleural space, that tiny space between the visceral pleura and parietal pleura. That's it. The definition says nothing about how expanded or collapsed the lung actually is. And this is the most important thing to understand. Pneumothorax and collapsed lung are not interchangeable terms. You can actually have a collapsed lung without pneumothorax, and you can also have pneumothorax without a fully collapsed lung. At first, that sounds weird, right? Because if the lung collapses inward, you'd naturally think air should fill that empty space. But that's not always what happens. In this X-ray, mucus plug blocking the main bronchus, and we have a bronchial cutoff sign here. Air can no longer enter the lung, and over time, the trapped air gets absorbed. Slowly, the lung collapses. Now, in this situation, instead of air filling the empty space around the lung, the mediastinum actually shifts toward the collapsed side and occupies that space. So yes, the lung is collapsed, but there is no pneumothorax at all. In this X-ray, trachea is shifted to the contralateral side of opacification. There is a massive pleural effusion. The pleural cavity filled with fluid, and that fluid compresses the lung until it collapses. On chest X-ray, the entire side may look completely white. In this case again, the lung is collapsed, but the pleural space contains fluid, not air. So once again, this is a collapsed lung without pneumothorax. Now let's flip the situation. Suppose air enters the pleural space because of trauma or rupture of a bleb. That air pushes the lung inward. If the pneumothorax becomes very large, the lung may collapse almost completely. This is the classic image most people think of when they hear the word pneumothorax. A collapsed lung sitting near the hilum with air surrounding it. But here's the important part. Not all pneumothoraces look like that. Sometimes the pneumothorax is actually very small. For example, this case of a pneumothorax, you can see the thin visceral pleural line here, but the lung is still about 90% or more aerated. And technically, that patient still has a pneumothorax, but nobody would really call it a collapsed lung because the lung hasn't significantly collapsed. And this is exactly why these terms should not be used as synonyms. A collapsed lung describes the state of the lung tissue itself, meaning loss of aeration and collapse of alveoli. Pneumothorax simply describes the presence of air in the pleural cavity. Sometimes they happen together, sometimes they don't. And once you understand that difference, chest X-rays start making a lot more sense, and these respiratory terms stop sounding confusing.